Local epidemiologists say the racial disparity in COVID-related deaths is smaller now than ever before.
This evening, ABC Action News in-depth reporter Anthony Hill is looking into those numbers.
During the height of the pandemic, we were reporting on how COVID-19 was impacting people right here in the Bay Area. We were also reporting on the disparities that existed.
New here at 5:30, African Americans have been disproportionately impacted by the COVID-19 pandemic. Black people are more likely than white people to die from the virus.
Today, that is not the case. The disparity is much smaller, and that's a good thing, no doubt about it. So I decided to find out what went right.
I was experiencing what I didn't know at that time, the symptoms.
Loretta Jackson thought she just had the common cold.
My daughter said, "Mom, go get tested." And I went and had the COVID test. It came back positive and came home and isolated myself.
Thankfully, she overcame the virus and she's thriving. But during the height of the pandemic, Blacks and Latinos were dying at a per capita rate of nearly twice the rate of whites. Now that the pandemic has waned, a survey by the CDC found that mortality rates for Black people and Latinos have fallen, and the disparity between the races is marginal. Some epidemiologists credit that to the rapid increase in vaccination rates among people of color.
And so the distance between the number of people that were vaccinated or not vaccinated in African American communities and that in our Caucasian counterparts has significantly narrowed during the past year.
Dr. Kevin Sneed also credits the work of local organizations such as We Care and Reach Up for the increase in local vaccination rates among people of color. During the pandemic, they traveled around the Bay Area, providing education and access to health care to underserved communities.
We had already known that we had a significant impact on having a much lower death rate, a much higher vaccination rate here in the Tampa Bay area per capita than many other communities all across the entire state of Florida.
It's no secret that there was a lot of vaccine hesitancy among the Black community, largely due to a long and complicated history with the medical community.
Yes,
but Black church leaders played an instrumental role in getting people pertinent, life-saving information about COVID and the vaccine.
The combination of good preaching, good teaching, and personal example, I think, was the key to that success.
Reverend Dr. Glenn B. James Jr. is the pastor of Allen Temple AME Church in Tampa. He's one of the many Black church leaders in the Bay Area to preach about the importance of getting vaccinated, not just for yourself, but for your family.
You know, you had a lot of young folk who, especially people of color, who were like, "I'm not getting it. I don't know what they put in that medicine. You know, I'm not gonna do that." And grandmother and grandfather said, "Okay, that's your choice. It's also our choice not to allow you around us. And so you can't come around here." Then that prompted them to say, "I don't want to live my life without having my grandparents who've been a vital part of my upbringing and my success."
The Allen Temple Church even served as a mobile vaccination site for people in the community.
And people begin to become familiar with the church because this is where they came to get their vaccination.
With the new Omicron subvariant, BA.5, being the most dominant strain spreading throughout the country, Loretta says she's already taken a booster shot and continues to be cautious.
A couple of months ago, I went to my college reunion and we were all masked up. When I come to church, I wear my mask. When I go now to the grocery store.
If you're interested in getting vaccinated or receiving the booster shot, just head over to our website, abcactionnews.com, where I've posted a link to where you can find the nearest vaccination site near you.